D.K. Gupta bringing into the conversation, sir. Dr. Gupta, I want to understand from your perspective, advice specifically for small children as well as the elderly, sir. What is it, any protocol that people with small children in the house or the elderly need to be following at this point in time?
I think current COVID surge is definitely for concern, but we need not to be panic also for children also. Definitely we know that children has good immune power against COVID. In this last COVID wave we have seen that also. But currently India has more than 1,000 COVID cases. Out of that around 750 are new, and more than 100 active cases are right now in Delhi and NCR also. It means I think we have to be more cautious, especially about the pregnant ladies and the small children also. If we see children less than 5 years, their immunity is quite low and they can develop sometimes complications, especially those children who are having sickle cell anemia, who are having thalassemia, who are having congenital heart disease, pneumonia or asthma, or sometimes suffering from liver disease, kidney disease, on dialysis or immunocompromised state, having on steroids. So these children who are less than 5 or suffering from these comorbidities, they should have been or more precaution. There should be given more precaution if they are having any symptoms of fever, cough, cold. That is known as influenza-like illness. If they are having more than 3-4 days and it is not, maybe he needs admission also and may require some tests like X-ray or blood counts and some other tests also, so that according to that like severity of illness, treatment can be given. Definitely, I will let you know. Like we can support children with other vaccines also, not COVID vaccines. Definitely, we have some other pneumonia and flu-like vaccines, also like influenza vaccine is there, Hib vaccine is there, pneumococcal vaccine there. I will suggest all the parents they should give all these vaccines. Those are available in the market, in the government setup also, and private setup also. These vaccines will prevent, definitely will not protect against directly COVID, but they will prevent from cross infections and they will also prevent from the complication of pneumonia and other diseases. So I think we should work on this, and definitely pregnant ladies, they can, if have the COVID, they can develop pre-labor pains also, premature delivery also, and complications in the neonate who is born. It can have infections, septicemia, jaundice, and respiratory distress. These complications can occur for neonatal who was delivered from a pregnant lady. So therefore, pregnant ladies also should have precautions before going out in a very crowded place, or they should wear mask, or they should stay inside. They should have proper sleep, or proper hydration, and all the antioxidants and medicine advised by their doctors. Especially those patients who are suffering from diabetes, hypertension, asthma, and other illnesses, they should definitely should have precaution, either being a children or adult or any age group. These are comorbid patients. They are very vulnerable and they can develop severe illness if they have COVID, or they can develop complication and have death also. These group of children, these group of adults who are suffering comorbidities, they should especially have precautions and stay out. Also, I think that also Dr. Swati Masri and Sanjeev Bagai told on that, but definitely I think we should, as India, Indian government and healthcare agencies, work on the COVID vaccines also on current
Okay.
variant available in the space. Not the
Okay.
previous vaccines. They will not be very effective in current scenario. And we require definitely vaccination for all these vulnerable groups and in first line like healthcare professionals and other administrative people who are first line volunteers or first line of our society. These should be vaccinated for the current strain. So we should have some strategy and policy, because this is recurring for last 5-6 years. We are watching it
Okay.
every year.
Okay. Interesting point there. I just have a couple of minutes.